I know you like it up. Yeah. So, well, Paul Black here again. I've debated on doing this for quite some time. And what this is I'm going to talk to you about my prostate cancer and the progression of it from the very beginning. Because the main reason I want to do this is I really believe that if my doctor wasn't one that believed in watching the PSA tests, that I may not be here right now. Finding cancer early is very important, and I think the PSA test was instrumental in probably saving my life. So I have a cheat sheet, so because I knew I'd never remember all the numbers and dates and whatever. So from the very beginning, at least I think this is the first PSA test that was taken, would have been in 8/1/2013. So I would have been 56 years old at that time. And the number was 0.93. And I think that's the baseline where it started, but it could have been rising already before that. Don't know, because I think this is the first number that we have to go by. But in 11/3, or November 3rd of 2014, that's 3 months later, it had gone up to, went from 0.93 to 1.90. And then 3 months after that, it went in February 2nd of 2015, it went to 2.67. And then in May 8th of 2015, it was 3.11. And I think the thing to remember is with the PSA tests and the numbers, it's not so much what the number is, but the rate that the number goes up. And because I thought at 3.11 even, it says normal is between 0 and 4. I'm still in there, But the urologist that I saw down in Duluth said that's a concerning number for somebody my age, and just what I've learned by doing research of my own is the way that the number was going up. That's what really raises concern. And so in 2015, it would have been shortly after that May 8th of 2015, with the 3.11, it was just within a week or maybe 2 at the most, where I had an appointment down in Duluth and had a prostate biopsy. And the results came back clean. Whoopee! So we thought we were good. And and actually the urologist at that time, he was of the opinion that you shouldn't look at the PSA for 2 years, because when you're doing the biopsy, you actually stir things up, and there can be an elevated PSA just from having done the biopsy that can hold on for quite some time. So that was his order for my doctor, and which we followed. And but in 2 years, on January 27th of 2017, which is just a little shy of the 2 years that the urologist was telling her to follow, my doctor to follow. In January 27th of 2017, it was 8.53. So in 2 years, my PSA had nearly tripled. Big red flag, that's a big red flag. And when my urologist, the one I'd seen down in Duluth, saw that number, heard that number, he wanted to do another biopsy yesterday, basically. I knew it was a really huge concern. And then I had a second biopsy. And at that time, You're probably not acquainted with a Gleason score unless you have dealt with prostate cancer. I didn't know anything about it until I was dealing with prostate cancer. And but my Gleason score came back at 8. And the way they come up with that Gleason score is they rate how aggressive the cancer is. One of the numbers is how aggressive the cancer is, and the other number is how much of it is in the prostate. So an 8 is very serious. It's hard to realize, hard to understand, but a 7 is much more treatable than an 8. You know, if you're 3, 4, comes out to a total Gleason score of 7, it's considered much more treatable than 8, and mine was 8. And so immediately after seeing that Gleason score at 8, my urologist wanted, once again, he wanted it done yesterday. It's like he couldn't do it quick enough, to have a bone scan and a MRI. I forget what all I had. Did that right at Hibbing, because we right in the Hibbing hospital. They've got really good scanning equipment there. So I had it all done right at Hibbing at the hospital, and there was, you know, it didn't look good, you know, and so it was a matter of basically the option was from friends and family and different ones, better to just get that prostate out of there than to try to mess with it. And so I gotta look at the date here. So that was January of 1/27/17. So it was January 27th of 2017. Started to really seriously look into getting a prostatectomy. And my wife Kathy and I decided, you know, at the Mayo Clinic they do many of them every year. And, you know, it doesn't matter if you're a mechanic or if you're a surgeon. If you do a lot of something, you're probably going to be better at it. So we chose to go down there. And part of the reason I didn't go to the urologist that did my biopsies is I didn't trust him, because he told us to wait 2 years, and it seemed like it was too long. You know, the cancer progressed a lot more than if we'd even checked it in a year's time. And so the prostate was removed, and not too long after that, after you have the prostate removed, they check the PSA, because it's kind of weird, but if you have prostate cancer and that cancer has spread to another part of the body, it will still give off PSA, or prostate specific antigen. It's a blood tested, that a marker in the blood that shows that there's something going on somewhere. And with the scans, we got down to the Mayo Clinic, and the day before, once again, I had scans, MRI, CT scan, and different things to, they wanted to have a good idea what the surgeon wanted to know, what he needed to do. So getting something just before the surgery was important. And we were informed before the surgery that the cancer had leaked out. They could tell by the MRI and the scans that I had, that the cancer had gone beyond the prostate. Not what you want to hear. You hope, you know, that's all contained in the prostate, so when they take it out, you're good. You know, well, that wasn't the case with me. And after the prostate was removed, they removed 26 lymph nodes with the prostate, and 5 of those lymph nodes had cancers, little tumors in them. And so anytime it's gone outside, you know, it's considered metastatic or whatever, where it's spread elsewhere. And it was a little bit scary, you know, and after the more we learned as we got into this, I remember Kathy and I talking, and, you know, she's sitting on the couch and me in the recliner there, and we just cried together a little bit because we don't know you know, how this is going to go. But anyway, went on Lupron. Immediately after the surgery, I went on Lupron Depot, which is a hormone blocker that it reduces testosterone, and the reason for them wanting to do that is testosterone is a driver for making prostate cancer grow. So reducing testosterone reduces the ability of the cancer to grow and spread. So when I had a checkup later on, I can't remember exactly what the date was, but several months later, that PSA had dropped to 0.01. And thought, whoopee again, you know, I thought, well, we're good, because anything below 0.1 is considered to be undetectable for cancer. And I just figured, wow, I don't need this Lupron if the cancer's not really there anyway. And I was really kind of misinformed because I didn't really understand how the Lupron would be reducing that PSA number. And I went off the off of the Lupron after, I forget what it was, 6 months or so, and then we checked the PSA and it started to creep up again, and I had some more scans in 2019, and in 2019 the scans showed that there was some spots on my sacrum, that's right below your spine. You got your pelvic bones attached to the sacrum, your ilium. Your ilium is really what your hip joints are in, and that sacrum is in the middle, and there's joints, and I've had trouble with that. The SI joint, the sacrum ilium joint, that's part of my age, giving me trouble there. But anyway, it's still back on Lupron, and the PSA has remained below 0.1. You know, it's crept up a little bit, but still under 0.1. And my urologist, I just changed urologist, one that comes up to Hibbing, so I don't have to drive all the way down to the Mayo Clinic. That he actually was down there as a resident with my surgeon, so he knew him really well, and he'll know if there's something that he can't deal with up here, he'll send me back down to Mayo anyway. So, but he said he's got patients that have been on Lupron for 20 years, and you know, the Lupron just keeps that cancer from growing and damaging more than it's already got. So that's about it. I'm going to just stop here so I don't get too long. So hopefully that's helpful to somebody. You know, if you're 45, 50 years old, it's a good idea to get that baseline number. Where's your PSA at? And especially if it starts rising, like I was saying earlier, the rate of the rise of that number, that's what tells you if there's, you know, something that going on, you know, if you got cancer growing out there somewhere. So with that, have a great day. Goodbye.